Okay, so this report is for March 2, 2008 data. The typhoid fever cases in Calamba, Laguna, which started in February 21. The total cases as of March 2 is 1,262, including both hospital and community cases. Of these, 194 suspect cases were confined in 4 different hospitals. 27 cases were confirmed by blood culture. The 1,041 suspect cases came from 13 barangays. No deaths. The National Epidemiology Center, together with the fellows of the Field Epidemiology Training Program, constituted a team, an investigating team, to, number one, find out where the source of the bacteria came from, and which has been identified as responsible for the typhoid fever, and so far there has been no report as to the definitive source of the bacteria which is responsible for the outbreak. It could be from the water. That's the strongest suspicion that we have. The NEC and the FETP team have conducted health education within the communities. They have coordinated with the DoH CHD 4A or Calamba zone, the health emergency management staff, which is based in the East Avenue Medical Center, all of this have been mobilized to set up the surveillance system. Ongoing investigation of the water system is being done. The planned activities would include case control study to identify risk factors, and also we will do environmental survey. New risk factors, the secondary infection is one concern. It's a genuine concern because you can have carrier states of typhoid fever, which means you may not demonstrate signs and symptoms, but you could spread the bacteria, especially among food handlers. So this is something that we're using as a basis for strengthening our community health assembly campaigns as to the proper personal hygiene and making sure that sanitation practices are being done. Of course, the other assistance that we have been given are lab supplies, antibiotics, the chloramphenicals, as well as the ciprobay. What's the generic name? Ciprofloxacin, and also IV fluids and other symptomatic treatments are being extended to the victims in the hospitals in Calamba City. Let me repeat that the laboratory results have yielded so far only 27 to be positive of the 221 specimens collected. So that's a result that was given to us after a blood culture was done on the 221 specimens. So we have informed, of course, the CHD4. We have instructed that additional medical staff or medical teams have to be deployed from the Batangas Regional Hospital. We have also given the same instruction to the Health Emergency Management staff of East Avenue. The San Lazaro Hospital also are putting up or putting together a medical team that will complement the efforts of the local, the city, as well as the provincial health offices of Calamba City and Laguna in general. So, so far, this is our update.